This information is not meant to be a substitute for professional medical advice. Always seek advice from your physician or another health professional regarding any medical condition or treatment.
My name is Penny. I'm a 42-year-old school teacher. 4 months ago, I had a heart attack. I was doing the dishes when I started feeling nauseated and had a bit of discomfort in my back and heartburn. It wasn't really pain, so I didn't worry about it. I thought I must have eaten something that didn't agree with me. I was shocked when they told me I had had a heart attack. It's hard to understand and cope with the fact that this happened to me, but I'm one of the lucky ones. I was given a second chance in life.
My name is Albert, and I am 57 years old, and I have had a heart attack. I was the director of education for a First Nations community in the north. I was feeling tired for days. I thought it was because I was working too hard. Then, one Sunday afternoon, my wife and I were visiting friends, when suddenly I felt a heaviness in my chest. I began to sweat and throw up. I had never been sick before. Then, they told me that I had had a heart attack after a week in the hospital. This was a wake-up call for me and my family, and I knew I had to change my life.
Hi, I'm Dr. John Dukas. Every year, more than 75,000 Canadians have a heart attack like Penny and Albert. The good news is that most people recover and lead normal lives. You need to know and reduce your risk for heart disease. Recognize the signs of a heart attack and act quickly to get medical help. People may have different symptoms when they have a heart attack. You may have pain which is sudden and does not go away with rest. The pain can be in your chest, neck, jaw, shoulder, arms, or back. You may not have any pain. Instead, you may feel a discomfort or burning, squeezing, heaviness, tightness, or pressure in your chest. You may be short of breath, have indigestion, nausea, or vomit. You may start to sweat and have cold, clammy skin. The symptoms of a heart attack can be different for men and women. Albert had sweating, vomiting, and heaviness in his chest. Penny had heartburn, nausea, and back pain. When you feel any of these symptoms, you may feel scared and anxious, or you may not think anything serious is happening to you. Something serious is happening to you. You need to act quickly. You need to stop what you are doing, sit or lie down to rest. Place one nitro tablet under the tongue or one nitro spray on or under your tongue. If the pain is not relieved after 5 minutes, repeat the dose. If the pain continues after 2 doses or 10 minutes, call 911 or your local emergency number or nursing station. You need to get to a hospital right away. Do not drive yourself. You may take a 3rd dose of nitro if you continue to have chest pain while waiting for help. A lot has happened to you since you came to the hospital. Having a heart attack was a terrifying experience for you and your family. A heart attack affects not only your body, it also affects your emotions. You may feel many different emotions. Anxiety, anger, and depression are common. It is normal to feel this way, especially in the first few weeks. Emotions are not right or wrong, they just are. They can affect not only you, but also your loved ones. Sometimes, emotions that have been pushed aside for years can come up now in both you and your family. Talking with each other may help deal with these thoughts and feelings. It may be easier to talk to someone other than your family. While in the hospital, you may have had a chance to talk to a staff member. If you think you will need help coping with your feelings after you go home, talk to your nurse to arrange this.
Is there enough room here? Yeah, I think so.
You will need time to physically and emotionally adjust to having had a heart attack. Plan to take time for yourself. Do things for you. Your family may need time alone as well.
It's still hard to believe and cope with the fact that this happened to me. I was at a very high risk of having a heart attack. My dad died of a heart attack at 42. My cholesterol was high and I was overweight. And I used to smoke about a pack a day. I know I can fight this because I'm willing to make changes.
There are ways to fight heart disease. You can reduce your chances of having another heart attack. First, you need to identify your risk factors. There are some risk factors that you can change and some you cannot. Penny has risk factors that she can manage, such as being overweight, high blood pressure, and smoking. Penny cannot change the fact that her father died of a heart attack at a young age. Albert cannot change the fact that he is First Nations and is at higher risk for heart disease. Also, he is a male over 45 with a strong family history of heart disease. However, Albert has several risk factors that he can change or manage, such as diabetes, high blood pressure, and a high-fat diet, and a lack of regular exercise. If you have risk factors in your life that you cannot change, it's even more important that you change the things that increase your risk. If you smoke, quit. Smoking is the most preventable cause of death there is. By stopping smoking, you will decrease the chance of a second heart attack or dying by 50%. 70% of people who try to stop smoking are successful. Let's see how Penny is doing with her efforts at smoking cessation.
So how are you doing with not smoking?
Well, I knew I needed some help, so I spoke to my doctor about it and he suggested the patch. So far, I'm doing okay.
So is anything else helping?
Well, yes, I joined the cardiac rehab program and started exercising regularly. The doctor said that regular exercise would help me to stop smoking, and I think it's helping. You know, one good habit leads into another. Anyways, it's one of the most important changes I've made, and I'm determined to do it.
You just had a heart attack. Weren't you afraid to exercise?
Well, the exercise part of the cardiac rehab program has been hard work, but I feel safe in exercising knowing the staff is watching. And it really helps me to know that other people who are exercising with me have had a heart attack as well. We've become quite close to each other and are a support group for each other.
There are many reasons for exercising regularly. People who exercise regularly are 50% less likely to have a heart attack. Exercise keeps your heart healthy, lowers your blood pressure, increases your good blood cholesterol, decreases the urge to smoke, controls your weight, improves your sleeping and your energy level, makes you feel better about yourself and improves self-confidence. Let's see how Albert is adding exercise to his daily routine.
What about food in the house?
I think we should stop at Safeway on the way home, pick up some for supper.
Hey, Albert. Hi, Amy. Hi. How are you guys doing? You come to see the practice?
I might watch them while I'm walking. I'm walking around the rink for some exercise.
No kidding.
No, he's not kidding. I'm going to be walking with him.
Why don't you join us?
Sure, I'll walk for a while. So why are you guys doing this?
To get stronger after my heart attack. It's still too cold outside for me, but in here walking is good.
I thought you'd have to take it easy after having a heart attack.
Well, that's probably why I had a heart attack. I was taking it too easy. I was nervous when I first started walking. My physiotherapist said if I feel a heaviness in my chest or if I start sweating a lot, I should stop. So far, I feel good.
I'm just glad you're exercising.
So when do you go back to work?
I don't know. That I have to discuss with my doctor. He says it depends on how much damage there was to my heart, how I feel, and how much work is involved in my job. The staff at the hospital said I could not drive for 4 to 6 weeks after leaving the hospital. As you know, I have a long drive to work.
So now what are you doing?
Stretching, it keeps the muscles from tightening up.
Here, let me show you. Come on in. Hand up here.
So how many times do you work out a week?
Well, I go to the program about 3 or 4 times a week, and it's hard, but I remember when I started walking in the hospital, I could only walk 5 or 10 minutes, and now I can walk an hour. Also, I'm finding the regular exercise is a benefit for all of our family. Instead of driving short distances, now we all walk. I'm also finding too my weight is staying lower, and I think it's because of the exercise. As well, doctors said my cholesterol is lower, and I'm even finding I'm coping with stress better.
Good for you, Penny. I wish I could do that. I have trouble exercising, and here you've had a heart attack, and you're doing it.
Well, you know, actually, I just feel better, and the staff at the cardiac rehab program said that just to start slow, and if I feel any of the things that I felt when I was having my heart attack, like indigestion or nausea or back pain, just to stop.
A common question that people have after a heart attack is, what could happen if I have sex? And if it's okay, and when is it okay? Your heart is a muscle that has been damaged, and like any other injured muscle, you need to give it time to heal. You can have sex with your partner 2 to 8 weeks after a heart attack. The time will depend on how you are feeling and if you're having any symptoms such as chest pain or shortness of breath. In the meantime, remember there are other ways of showing affection, such as hugging and kissing, which are okay to do right away. To reduce the work of the heart, wait 2 to 3 hours after a heavy meal. Avoid sexual positions that keep you on your arms for a long time.
Healthy eating is a big part of having a heart-healthy lifestyle. Healthy eating gives you the balance of food that help keep your weight down and lowers your risk of having another heart attack.
Choose whole grains and a variety of fruits and vegetables for healthy eating.
Hey, Martha, what are you doing there?
Hi, Albert. I'm just cutting up veggies.
That's what I like about you. You're always busy in the kitchen. Can you believe this? Both of us from the same family, and both of us have had heart attacks. Have you changed your eating habits?
I used to skip breakfast or grab a donut. Now I have a bowl of porridge or whole grain toast.
I don't like cereal. I do like to eat whole grain rolls, though.
Well, of course you like everything.
What about junk food? Do you still eat junk food?
I don't eat much junk food now. I snack on fruits and vegetables. They taste good and it's easy once you remember to buy them.
I don't like milk, but now I drink it with every meal. They say that low-fat foods can help lower my blood pressure.
I eat more fruits and vegetables and less meat. I buy skinless chicken, lean meats, fish, to help reduce bad fats in my diet.
I didn't know how much meat I used to eat. They say at the hospital that a good portion is about the size of a deck of cards. Now, Amy and I, when we prepare meals, we try to use less fat. So we use our good friend olive oil and canola.
We actually cook food from scratch and we use less salt.
And we try to spice things up by using more spices. I never worried about my health. I ate foods that I now know were not healthy. After my heart attack, I changed my eating habits and life in general. I learned that healthy eating is important. It's a bit hard at first to start. Not everything the dietitian at the hospital said was available up north, so I had to think of what I could get that was just as good.
At each meal, follow the rainbow of Canada's food guide and choose foods from each of the 4 food groups.
Cut down on fat and salt, eat more fiber, and use spices to improve flavor. Fruits and vegetables increase the fiber and keep the fat in your diet low. Choose a variety of fruits and vegetables. They can be fresh, canned, frozen, or already prepared. Choose small portions of meats with very little fat, such as skinless chicken, well-trimmed beef, pork, caribou, or moose. Eat fish 3 times a week. Try to have legumes like kidney beans, chickpeas, and lentils more often. They are low in fat and high in fiber. Instead of frying, bake, broil, roast, grill, boil, or barbecue your food.
Make low-fat milk products part of your day.
Choose grain products and increase fiber. Eat oatmeal, cereal, and whole grain toast. Besides making changes to your lifestyle, you will need to take medications for your heart.
There are usually 4 pills that are taken after a heart attack. These are aspirin or other similar drugs, beta blockers, ACE inhibitors, and cholesterol-lowering drugs. These pills lower the chance of you having another heart attack or dying from heart disease. After a heart attack, people who take these pills have a greater chance of living longer, healthier lives. You will most likely have to take these pills for the rest of your life. Make sure you take these pills exactly as you were told.
Hi, Karen.
Hi, Albert. How are you?
Oh, pretty good.
Are you here to pick up your refills for your medicine?
Yes, I'm almost finished and I don't want to miss taking any.
Sounds like you figured out a way to help you take your medications regularly.
Yes, that pill container I got from you is good to sort out everything.
I'm really glad to hear it. Are you having any problems with your pills?
No, but I do have a question.
Sure, go ahead.
Seems every year I get a cold or a flu. Is it okay to take my flu or cold medicines with my heart pills?
That's a really good question, Albert. I'm glad you asked. Always check with me before you buy anything. Doesn't matter if it's something you buy over the counter, such as a herbal medicine, or something your doctor may have ordered for you. Some medicines may not work well with your heart pills and cause you problems. If you're having any problems, please call your doctor, talk to your nursing station, or myself.
Wonderful. Chimigwich.
Have a wonderful day. Bye-bye.
A cardiac rehabilitation program is one way of helping you make lifestyle changes. Research has shown that people that go to a cardiac rehab program live longer, are less likely to have another heart attack, have an improved lifestyle, reduce their heart symptoms, have increased confidence and a sense of well-being, and have better strength, flexibility, and health.
I knew I had to make a lot of changes in my life, and I knew it would be hard to do this alone. I joined a cardiac rehab program. It was great because I was able to talk to others who also had heart attacks and who were going through some of the same things that I was. I also found out that there are many people willing to help. I was told about the services in my community that could help my family and me.
In the north, we don't have the same services as they do in the city. But most places have school gymnasiums or recreational centers, which are open in the evening. I can go there and be with people and get some exercise. I have a second chance in life. I am grateful to be with my family and children. We are busy enjoying the outdoors. In the summer, we go fishing and boating. In the winter, we all go snowshoeing. And on occasion, I go hunting for moose with my son. I am grateful to be with my family and to be alive.
My goals are simple and possible to achieve. I know that with the support of my family and friends that I can continue to lead a healthy and productive life. I know I can do it, and you can too.
If you would like more information about your heart health, please contact
the Cardiac Rehabilitation Program at the Wellness Institute at Seven Oaks General Hospital, the Refit Center, the Heart and Stroke Foundation of Manitoba, Health Links, or your local nursing station.